So I want to talk to you a little bit about erectile dysfunction because it's an important topic and it's usually a very uncomfortable topic for most men. No one likes to ask their friends if they too are having problems with their erections. It's not a typical dinner time conversation. However, it is a very important health matter, and also it's a very important quality of life issue. The first reason why it's a quality of life, or rather an important health matter, is because erectile dysfunction often happens in men because the arteries to the penis get clogged. And it so happens that the arteries of the penis are actually thinner and smaller than those of the heart. So erectile dysfunction is actually a foretelling sign of upcoming coronary artery disease. In fact, the way that the drug Viagra was discovered or developed is it was first designed as an arterial dilator for heart disease. And then once the study was over, no one wanted to give back the samples because they were having such great results with their erectile dysfunction. So that's how they end up realizing, hey, this is actually working even better for the erectile dysfunction than for the coronary artery disease. Regardless, I think that it's important for men to realize that there are solutions for erectile dysfunction. So the arteries going to the penis being clogged, well, there's a solution for that. There are drugs like sildenafil or several others now that help relax those arteries and dilate them. But eventually those medications stop working. So there are other ways of treating erectile dysfunction. There are procedures that help restore the integrity of the arteries, new procedures that have come out recently, which you can read about on the website here. But there's also surgeries that are also eventually, if someone has tried all the other venues, and there are surgeries that restore erections completely without compromising sensation or climax. And they're very effective. They're not even actually new. They've been around for quite a while, and they have a very high satisfaction rate. So erectile dysfunction is a treatable health concern, and the sooner that you start addressing it, the better it is, because eventually if you neglect your penis for too long, it actually starts shortening. So even for men who desire to restore their erections with a penile prosthesis, for instance, if they haven't had an erection in 3-4 years, then the length of the penis is actually shorter. So even with a prosthetic, they cannot get their original length back. So just remember, if you don't use it, it definitely gets smaller. You won't necessarily lose it, but it definitely gets smaller. So sooner than later, seek treatment with your provider and ask questions about how to get diagnosed if you have erectile dysfunction and how to get it treated best for you.